Hi, I'm Dr. Choong Fong, consultant ophthalmologist at the International Specialist Eye Center. This video is about esotropia, or what is commonly known as convergent squint. What is esotropia? Esotropia is the turning in of one or both eyes. It may be intermittent, in other words, occurring sometimes, or constant, in other words, occurring all the time. It may occur when looking near or when looking far, or sometimes it occurs looking near and far. Esotropia may only affect one eye, or it may alternate between eyes. Esotropia may occur at any age, and the opposite of esotropia is exotropia, whereby the eyes turn outwards. Is esotropia ever normal? Esotropia in infants less than 20 weeks old frequently resolves spontaneously, especially when the misalignment is intermittent and small in magnitude. However, a constant eye crossing at any age should be evaluated promptly by a pediatric eye specialist. If you note any eye misalignment in your child, you should consult a doctor. This is especially important since some squint is caused by more serious eye conditions such as infantile cataract or retinoblastoma, which is a form of eye cancer in children. Such serious eye conditions must be detected early so that treatment can be given promptly. A delayed diagnosis and treatment can have serious consequences to the eye and to the child. Do children ever look cross-eyed but actually have straight eyes? This condition is called pseudostrabismus, which gives an appearance of squint, but it is not a true squint. It is not a true squint in the sense that the eyes are not misaligned, but only have the appearance of a squint. This is usually secondary to the shape of the eyelids, or the child may have a broad nasal bridge, and is particularly common amongst East Asian. Nevertheless, any child suspected of having ocular misalignment should have a thorough examination by a pediatric ophthalmologist. What problems can esotropia cause? The effect of esotropia on visual system depends on the frequency and severity of eye crossing and the patient's age. Eyes crossing affects the ability of the eyes to work together. Older children and adults with a new constant esotropia often experiences diplopia or double vision. Children can lose 3D vision and the ability for simultaneous use of the eyes. Additionally, the convergent eye, which is not used, may lose vision to amblyopia or lazy eye. Does esotropia run in families? Strabismus or any misalignment of eyes can run in families. However, affected family members do not necessarily share the same type or severity of strabismus. A family history of strabismus is a very good reason for an evaluation by a pediatric ophthalmologist. What are the different types of esotropia? There are many types of esotropia, and a detailed discussion is outside the scope of this video. I will only mention a few of them, and some of them that are important and more common. Number one, accommodative esotropia. Some children are born with moderate to high degrees of hyperopia, otherwise known as farsightedness. Children with hyperopia need to accommodate, in other words, to focus hard when they are using their eyes, and this effort to focus hard causes the eyes to converge in. This condition is typically noted between 2 to 4 years old. Wearing the appropriate glasses correction will relax the focus and therefore correcting and reducing the angle of squint. Infantile esotropia is another type of convergent squint, and this type of convergent squint is normally noted very early in life, typically between 3 to 12 months of age. The angle of screen is typically large and obvious. The treatment of this condition is surgical and should be done early in order to have the best outcome, including the restoration of normal binocular vision. Estropia can be due to poor vision, and any causes of poor vision can cause esotropia. Esotropia can also be caused by neurological conditions such as stroke, brain tumor, raised intracranial pressure. The management of this condition involves getting the diagnosis correct and treating the underlying conditions. Estropia can also be caused by a large number of medical conditions such as thyroid eye disease, myasthenia gravis, and Duane syndrome. How does a pediatric ophthalmologist evaluate a child with suspected esotropia? After taking a careful history, the doctor assesses the visual acuity in a manner appropriate for the age. A key component is to determine whether the acuity is equal in each eye or if one eye is stronger than the other. Ocular misalignment, if detected, is measured using prisms. The general health of the eye, as well as the refractive state of the eye, in other words, if there is farsighted or nearsighted or astigmatism, is also measured. What are the treatment options for esotropia? Management of esotropia is based on a number of factors and its cause. However, the overriding principles are these: to re-establish the normal ocular alignment, to maximize the quality of binocular vision, to relieve double vision if it's present, and to treat any associated lazy eye or amblyopia. Treatment modalities include spectacles, sometimes with prisms, sometimes bifocal lenses are required. If there is any amblyopia or lazy eye, occlusion therapy or patching of the good eye or the better eye is necessary. And in some cases, strabismus surgery or eye muscle surgery is required in order to get the eye fully aligned again. I hope you find this video helpful, and thank you for watching.